Want me to start sharing it so you can check to make sure everything like looks okay on your end?
Yeah. So I think we could just get started now. And yeah, so just whenever you're ready, you can share your screen.
Sounds good. Give me just 1 second here. Okay, can you see my screen?
Yes, we can.
Okay. So in regards to like comments, if there's questions and stuff, will you be able to just tell me if there are questions? Because it's really hard when I share the screen to see the chat box. Is that okay?
Yeah, of course. Yes.
Okay. All right, so I'll get started.
Yep, sounds good.
Okay. So hi everyone, I'm Avi Varma. Thank you so much for asking me to come and speak with all of you today. So just a little introduction about myself and then I'll get into the presentation. I'm a board certified family medicine physician and I went to the American University of Antigua School of Medicine for my medical school. And then for residency training, I trained at Mount Carmel Health System, which has a family medicine residency program based in Columbus, Ohio. After graduating from family medicine residency training, I started my first job out of a large hospital based healthcare system. So I worked as an outpatient primary care physician as part of a large group. We had about 10 physicians in that clinic based setting. And then I actually transitioned to another large healthcare system, but in that sense, I had worked in an urgent care setting. So I switched from primary care to urgent care, and then finally ended up in my current position where I work for a nonprofit organization. And in my current position, I still practice outpatient primary care, but I also practice HIV care and management as well. So all of our patients have HIV and AIDS. And so we provide them with their medications, make sure we're managing their HIV and AIDS, and we also manage their other primary care needs as well. Additionally, outside of work, I work full time. I'm also doing my master's in public health through the Johns Hopkins Bloomberg School of Public Health. So that's a little bit about me. I have no financial disclosures and nothing I discuss during this presentation is representative of my employer. So one thing I like to start with, especially with these kinds of presentations, is for the audience to really ask themselves, what is your why? So why do you want to pursue medicine? I think it's an important question to ask because like many fields, medicine is a very difficult field. It takes many years to kind of get through training. So you really need to understand what your why is. And that will actually help you when you're also applying to medical school and into residency as well. So is it, for you, is it to help others in a significant way? Is it to build meaningful relationships, find some sort of job stability? Is it because you want to make a lot of money? Is it because you have an interest in lifelong learning? It doesn't have to be one reason. It could be many of these reasons. And these are just some of the reasons that you might be choosing why you want to pursue medicine. Okay. So for me, why I chose the field of medicine in general is that growing up, I had significant experiences that really led me to the field of medicine. I had some great role models in some of my extended family. And so because of them, I really gained an interest in the field of medicine. And I constantly love learning. And as we know, medicine is one of those fields where things are changing always. So you're constantly learning new things. And so for me, it's been definitely an exciting field to be part of. And then I just wanted to share a little bit about my journey. So one thing that I realized over the last several years is, my goal was, okay, I always thought I want to be or get into medical school. That was my goal. And then it was, I want to get into residency training and then I'll be set for the rest of my life. So, one thing to realize is that your journey is a constant kind of evolution. And I don't believe that for myself that my first job out of residency was the right fit for me. So, I felt like it took a long time for me to really find the right fit. Does that mean that I did not have the right trajectory or didn't do the right things? No, it took me time to find the right fit. And so for those of you that go through med school, go through residency and still feel like, I'm still searching for the right fit for me in terms of the right job, just know that you're not alone in that. that's actually quite common. So, for me, it took me a while to realize, this is the population that I want to work with and care for. So for me, I find it fulfilling to work with more of an underserved population. And that's the kind of work I get to do in the nonprofit organization that I work for. So that's, and I just realized I'm not even in presenter mode, so I apologize for that. But that's really, something to kind of think about as you go through your personal journey. So, what is family medicine? So, family medicine is the field that I chose. And so, just telling you guys a little bit about that. So, basically, in family medicine, we provide comprehensive and continuing medical care to all age groups. So, that's from newborn babies to the geriatric population. We provide preventive care services. So, we educate our patients about their health conditions. We also can perform some cancer screenings, specifically cervical cancer screening, but we also refer our patients to make sure they're up to date on their other cancer screenings, which are really important. And then making sure our patients are up to date on their immunizations as well. We can also provide chronic disease management, so diabetes, high blood pressure management, et cetera. You can really care for a lot of different chronic conditions without even having to send the patient to a specialist right away. So that's nice because you're kind of like the first physician that your patients will likely be seeing. If you are interested in procedures, you can perform some minor in-office procedures as well, like incisions and drainages. So that's for if a patient comes in with like a little pocket of infection or abscess. Skin biopsies. So if you're doing an annual physical exam and then you notice an abnormal mole, you can actually biopsy it in the clinic. Joint injections for patients that have arthritis and joint pain as a result of it. So you can do joint injections as well. These are just a few that I wanted to name, but there are many more that you can do. And then, of course, you do manage specialty referrals. So basically, what I like to say for family medicine is you're kind of the home base for the patient's healthcare needs. And from you kind of like send them off to specialists that you think they will need to see. In regards to screenings, you send them off to do the mammograms once a year for women who are of age that require the screenings, colon cancer screening. We know the guidelines have changed recently in regards to that. So, what are some job opportunities for family medicine physicians? So, there are actually many. So, oftentimes people think family medicine means that you're just doing outpatient medicine. You can, and that's the pretty standard kind of go to track that a lot of people take. But you can also work in the inpatient setting. So, you can work in in hospitals as a hospitalist. Which is a nice opportunity to do more acute care. You can work in urgent care, which is another thing that I did. You can go into academics. So if you're interested more in joining a university in an academic setting, then you can do that. And in that opportunity, oftentimes you not only see your own patients, but you also get to basically educate future physicians, which is a great opportunity as well. And you can also go on to pursue further education. If you decide, I want to do a fellowship and specialize into another field, you can certainly do that as well. And I'll get into that in just a moment. So, what kinds of settings can you work in? So, I had mentioned earlier that I worked in a large healthcare system. So, you can do something like that. You can work in community hospitals or community clinics. You can work in rural settings where usually there's oftentimes a high need for physicians. And you can work in private practice, whether you join an already established group or you start your own group and clinic. So you could do things like that as well. And then you can do what I do, which is to work for a nonprofit organization. So I had mentioned on the previous slide about fellowships. So here are some of the fellowship opportunities that are available to family medicine trained physicians. So you can train further into addiction medicine, adolescent medicine, emergency medicine. So you practice essentially as an ER physician, going from a family medicine training background, geriatrics, and oftentimes you can work in nursing homes, but also you can work on the inpatient side of geriatric care. hospice and palliative care, integrative medicine, obstetrics, especially if you're in a rural setting where there might not be as many obstetricians. That's a great opportunity. Sports medicine, which isn't always just from internal medicine, you can actually do it straight from family medicine, or excuse me, also from ortho, and women's medicine. Now, if you are interested in the full list, you can go to the aafb.org website for that. So here are some questions that I commonly get asked about family medicine. So why did I choose family medicine? So for me, there were basically, when I was going through my medical school clinical rotations, which occur in the third year, I really liked different aspects of the different specialties that I rotated through. I wasn't much into the surgical procedures, so I knew that surgery was not the field for me. I also knew being an obstetrician was not something that I planned to pursue. I was interested in women's health, but I knew that delivering babies wasn't the route that I was wanting to take. But I did really enjoy internal medicine and I loved pediatrics. So one way to combine both of them is to go through family medicine training. And so that's why I chose it. Now, another question I often get asked is, what is the difference between family medicine and internal medicine? So, in terms of one of the differences is the fellowship opportunities that are available. So through internal medicine, you think of kind of the standard specialties that you can train into. So cardiology, pulmonology, critical care, gastroenterology. So these are all fields that you can do fellowships in after completing an internal medicine residency. Whereas the fellowship opportunities that are available for family medicine are the ones I discussed on the previous slides. Other differences are that in family medicine, you do rotations in OB-GYN, you do rotations in general surgery, which you won't be doing in internal medicine. So there are some differences there. In terms of things that are similar, you still do inpatient rotations where you're seeing patients in the acute care setting. You do outpatient rotations where you see patients in the outpatient setting. And you also do intensive care unit rotations as well, just like in internal medicine, but you don't do as much of ICU basically in family medicine as you would in internal medicine. So how long is residency training for family medicine? That's another question I often get asked. And traditionally, it's a 3-year program, just like with internal medicine. I think there are few programs around the country where it's 4, but it's generally combined with something else. So it'll be FMIM or it'll be FMEM, which is emergency medicine. So what does an average day in the life of a family medicine physician look like? So it really depends on which kind of route you take, whether it's outpatient or inpatient. And traditionally clinics are 8 to 5. And so that's kind of my schedule is 8 to 5. There are some clinics that do extended hours or start early in the day to accommodate for patients that are working full time and that can really not take time off from their jobs. And some clinics may even be open on the weekends. So it is a little variable, but traditionally speaking, it's an 8 to 5 job, Monday through Friday. And then the final question I often get asked is, do you have a work-life balance as a family medicine physician? And, I think balance is really it depends on the individual. So one person's definition will be different from another person's definition. So for me, work-life balance meant that I wasn't working evenings and I wasn't working weekends. I got that time to spend with my family. Whereas for someone else, it might be, I worked 12-hour shifts 7 days, and then I'm completely off from work for 7 days. So it really depends on your definition of work-life balance. But to answer that question in the simple way, it would be yes, you can have work-life balance as a family medicine physician. So I wanted to get into a case presentation and share that with all of you. So, and this is like a classic example of what I've seen in the clinic over the past several years. So Mr. A is a 57-year-old African-American male who presents to the clinic with excessive urination, excessive thirst, and excessive hunger. He complains of feeling tired all the time and has had numbness and tingling sensations in his feet. His past medical history includes hypertension, which is high blood pressure, and hyperlipidemia, which is high cholesterol. Hasn't had surgeries in the past. He's a current smoker. He's married. He has family history of type 2 diabetes, hypertension, and hyperlipidemia in both of his parents. He has no allergies to any medications, and currently he's taking lisinopril, which is a blood pressure medication, and atorvastatin, which is a cholesterol medication. So here I've kind of bolded or highlighted the aspects of the physical exam and vital signs that that stand out to me a little bit. So in this case, this patient's blood pressure is slightly elevated and he weighs about 200 pounds. In terms of his physical exam findings, everything is pretty normal except when it comes to his skin and neurological exam. So his heart sounds are good, he's breathing normally, no abnormal lung sounds, abdominal exam is normal. He's a little anxious and tired, but otherwise, generally speaking, appears normal. He does have these darkly pigmented patches that are kind of on the back of his neck and in his underarms as well. And then in terms of his neurological exam, one of the things that we do is what's called a monofilament foot exam. And basically we're checking for sensation at the bottom of his feet, and it shows that there's some decreased sensation in 5 different sites of his feet. So what do you kind of do next in terms of the workup? Usually what we'll do or standard is to order blood work. So you look at you'll order a comprehensive metabolic panel that includes electrolytes like your sodium, potassium levels, your sugar or glucose, kidney function and liver function. Then we also order hemoglobin A1C, which is one of the tests you can do to diagnose diabetes. A urinalysis, because he did mention, excessive urination. So let's make sure there's no infection. Let's see what's going on in the urine. And then a complete blood cell count. So in terms of the pertinent labs that came back appearing abnormal, the creatinine or kidney function was slightly elevated. The glucose was very high at 300. His hemoglobin A1C was 11.5%, which is high. And in his urine, we see glucose and we see some protein and ketones. And ketones are a sign of some dehydration. So he'd been, thirsty, urinating more frequently, and his hemoglobin, it could be borderline low. So what was the diagnosis? So his diagnosis is type 2 diabetes. Okay. So I want to talk a little bit about type 2 diabetes. So basically, in the United States, there are more than 34 million Americans that have diabetes. Oh, I'm so sorry. That's about 1 in 10 people. Approximately 90 to 95% of the persons that have diabetes actually have type 2 diabetes, which is insulin resistance versus insulin deficiency. Insulin deficiency is type 1 diabetes. Most often, persons that are over the age of 45 are affected by diabetes, and common symptoms include the following. So polydipsia, which is excessive thirst, polyphagia, which is excessive hunger, and polyuria, which is excessive urination. So we commonly refer to these as the 3 Ps. You don't always have to have these, but it's something that's been an indication for diabetes for sure, or indicative of it. Visual disturbances are common or can occur. Neuropathy, which is decreased sensation, like we did on the physical exam. You could generally just have a low energy level or fatigue, vague abdominal discomfort. These are just some of the common symptoms. There could be other things as well. In terms of diagnosis, so ways to diagnose diabetes are testing a hemoglobin A1C, which is basically a percentage of the average of the blood sugars over the past 3 months from the time leading up to the time that the test is actually performed. So within the last 3 months before the test is performed. So anything that's 6.5% or higher means that they have diabetes. Another way to test is actually just looking at the glucose level. So usually you can test it 2 different ways. One is you do it fasting, which means, the patient has not eaten anything in the past 8 to 10 hours, and then they come and have a glucose test done. So if it's 126 or higher, then you can diagnose diabetes. Another way is just doing a random glucose level. So it doesn't matter they ate within the last hour, and you check their glucose. It shouldn't be above 200. If it were above 200, that is abnormal. And another way to test, and this is often done, or this is done as part of OB visits for persons that are pregnant, is a 2-hour plasma glucose level, which is 200 or higher during a 75-gram oral glucose tolerance test. In terms of treatment, I'm not going to really get into all the details of different medications, but you can use oral medications, which are generally how we start in terms of management of diabetes. There's insulin therapy, which oftentimes we use later down the road, if oral medications aren't enough. But sometimes, some patients are started on insulin right away, depending on how high their levels of blood glucose levels are. There are some other injectable treatment options as well that are very beneficial. Additionally, diabetes can affect a lot of different organs, right? So we want to make sure we're protecting basically the human body. And other things that unfortunately can come hand in hand with diabetes are high blood pressure or hypertension, high cholesterol or hyperlipidemia, and also heart disease. So other things to make sure you're doing are making sure the blood pressure is under control, because that in combination with diabetes can really affect the kidney function. And then making sure your cholesterol is under control, because you also want to make sure that you're not increasing the patient is not at increased risk of heart disease. Making sure the patient is following preventive measures, so modifying their diet, exercising regularly, making sure they're up to date on their vaccinations, because unfortunately diabetics are at higher risk of certain infections. So for example, we want to make sure they're up to date on their pneumonia vaccines. Additionally, you want to make sure that they get an annual, or maybe it's now biannual, diabetic retinal exam, because like I said earlier, diabetes can affect so many different organs. That includes the eyes, the kidneys, it can really affect a lot of different aspects. And we talked about neuropathy or the nervous system being affected as well. So referrals can include ophthalmology for the diabetic retinal exams, podiatry for the foot exams, although really that's something that family medicine physician can do, and they just have to do once a year. Now, if there are signs of vascular disease in the feet, then you definitely do want to have a podiatrist likely involved at that point. And then nephrology in case they have developed chronic kidney disease that's close to kidney failure, or if they are in renal failure, of course. So that's kind of the introduction, just wanting to talk about, and it looks like there's someone here that wanted to be admitted, so I'm going to go ahead and do that. Kind of going into, why medicine, why family medicine, what family medicine is, and then giving you guys a case presentation. I want to stop real quick and see if anyone has any questions. And if not, then I can kind of get into the rest of the presentation. Okay. So I'm going to keep going then. So I'm going to talk a little bit about high school and like what you can do to prepare for a career in medicine starting in high school. So here's just some standard tips that I like to follow or recommend. So first, you want to build a solid foundation in science and math. Consider taking advanced placement or AP courses if they're available. So the ones I generally recommend would be bio, chem, physics, calc, and statistics. You want to build good study habits early on. So these are, your test taking skills, time management, and communication skills as well. In terms of study habits, you have to see what really works well for you. Are you the type of person that does better with live classes, like in a group setting, or are you better one-on-one? You really have to see what works best for you, and one answer isn't right for everyone. So you have to see what works for you as an individual. Other things you want to do to prepare are to get involved in extracurricular activities. So volunteer in a community service organization or at a local hospital, although I know that's probably limited because of COVID right now. And consider shadowing a physician in a local health clinic. In terms of tips, I'm going to provide them kind of intermittently, but choose longer term activities instead of shorter term activities. This really will show your commitment to the field. So instead of like a 1 day health fair, maybe consider something more long term where you're shadowing a physician in a field that you're interested in. So if you're interested in pediatrics, make sure you try to find an opportunity where you shadow a pediatrician. Now, that being said, it may be too soon for you to know what field you really want to go into, and that's totally fine. But if you do shadow a physician in a certain specialty, it may help you decide, for example, or at least understand, is this a field you're even interested in? Sometimes it's just a way to even rule out other certain specialties. And in regards to experience, it shows that you have gained some experience and that you're interested in the field of medicine by actually doing something like this. Additionally, you could try to get involved in medical research. I know it's a little bit more difficult coming from high school, but there are programs that allow it. Now, you could go through a local college or university to see if you could do some kind of research, or a local research center. There are summer research programs as well. Definitely visit aamc.org if you're interested. I provided a link here in the presentation. Another pro tip is to draft an email template that you can use when asking to join a research team. So customize the template to the specific research program and state why you're specifically interested in joining their team. So you can have a basic template, but make sure you do actually cater it to the program or the research group that you're wanting to join. That way they know, okay, this person actually is showing interest, we should consider them. Other things now, moving into college. So different things that you need to be aware of is you're going to have to meet the pre-med requirements. Now you got to check with your college to confirm their specific pre-med courses, because it may vary slightly. But generally speaking, you have to complete 1 year of biology with lab, 1 year of general chemistry with lab, 1 year of organic chemistry with lab, 1 year of physics with lab, and then 1 year of English. Pro tips are to connect with your college advisor early on and to inform them of your goal to apply to medical school, so they can kind of cater certain things towards your specific goals. Confirm the pre-med requirements, like I said, for your specific college. And some of your AP classes that we talked about, depending on the scores that you get, may count towards some of the pre-med requirements. Doesn't mean that you have to use your AP classes towards your college courses, because some people are like, I really want to take it at the college level versus AP, although AP is technically considered that, and that's fine. But another thing is that, using your AP scores, you may be able to, in a sense, test out of that class, and you already have the credit for it. You've met that pre-med requirement. One thing I really like to emphasize is that you do not need to major in a science field to be pre-med. So the courses I've listed at the top here are generally the courses you need to take to be considered pre-med. You can major in anything you want to. So, and I would even consider it. Like, if you have another area of interest, then maybe even think about majoring in that. For example, if you're like very interested in languages, interested in Spanish, you could major in that. You can major in business, even if that's something of interest to you. So why am I emphasizing this? When it comes time, when you fast forward to your interviews, you can even say things like, I majored in business because I'm interested in the business side of medicine, where I want to start my own practice. And I think that my background in business is going to really help me to start my own private practice in the future. This shows medical schools and residency programs that you've really thought about why you want to go into medicine. And that really comes back to your why again. So, if you have something in mind, these are things to consider, because it is something that will be looked at very positively when you're applying. More pro tips for you guys. So consider completing your pre-med classes in the first 2 years of college. Pick a major that may still play into your choice of medical specialty. So I kind of already mentioned this on the last slide, but you could be interested in psychology. So you could say, I have an interest in mental health and psychiatry. I already talked to you about business as another option. And what I would suggest is create kind of a draft template or schedule for the next 4 years, or the 4 years of college. And if you're planning on taking less time or more, then accommodate accordingly. And basically plan out how you're going to spend your time in college. Talk to previous students about the level of difficulty of classes you're planning to take. So one thought is, usually organic chemistry is very difficult. So, know which classes will be hard in advance. So when you're planning your schedule out, you can balance your classes per semester. So for example, one semester you can take one hard class and two or easier classes, because you want to make sure you're doing well in terms of your GPA. So you don't want to take a ton of like 3 hard classes in one semester, when on top of that you may be doing extracurriculars and research and all this other stuff. You're going to be overwhelmed and you'll get burnt out. That often happens, not saying you will, but it does often happen, unfortunately. So plan ahead. If a class is known to be difficult, maybe consider getting a tutor or join a study group. Your schedule, even though you're creating this draft schedule, just note that that may change slightly over the course of the 4 years, and that's okay. When I started my MPH, so I'm doing it part-time, and so it's not a 1-year program for me, it's longer than that. And so my template that I've created, my course schedule that I've created, it does change, but I have a good basis and I know where my core classes are and things like that. So it's important to kind of plan ahead and just understand, though, that things will probably change slightly, but at least you have a basis or a foundation to work off of. And then connect with your professors. You never know, one may become a mentor to you or even be able to provide you with a letter of recommendation for medical school, especially in these large class settings like bio and chem, where you might be in a large lecture hall. You're not going to get to know your professor one-on-one in that setting, unless you're someone that's very confident and raising your hand and like talking during class, as in like answering the professor's questions that they ask. But if you're really not like that, I'm not like that. I'm more of a one-on-one person. So, in that regard, finding their office hours, making sure you connect with them then, especially if you have questions, they want you to ask those questions and they'll show them that you're interested and invested. So those are definitely key opportunities that you should not pass. So coming to kind of things outside of classes during college that will help you prepare for med school are to get involved in extracurriculars. So I already mentioned these. And basically the one thing that I was saying might change would be to shadow a physician in a local health clinic or through the university medical school, if there is one at your university. In terms of getting involved in medical research, that's another big one to definitely consider while you're in college. So ideally choose a field that you're interested in, but again, if you don't know, that's totally fine. And then don't be disheartened or discouraged if you get a no as an answer. But this is exactly why I say contact many researchers and departments, because you may get several no's, but it really just takes one yes for you to actually be able to start medical research. And then getting your name published in a research paper will definitely look good. But if you don't have that opportunity, that's okay too. As long as you're doing more longitudinal research, it will still look really good on your applications. And then additionally, if you have the time or you're looking to make some money as well, then consider doing something more medical related, because in the end, that will still look really good on your application. So for example, work as an EMT, a medical scribe, or become a certified nursing assistant. Those are things that you could do. Now, that all being said, you still want to be able to maintain a good GPA. So definitely coming back to the first point of what I was talking about how to prepare in college, is making sure you maintain a good GPA. So if you don't have the time and you don't have to do the work, then I wouldn't necessarily consider picking up a job, but only if you have the time. So now I want to come to med school admissions. So I really liked this graphic with kind of the timeline that was provided through the Kaplan website. I have the source and link listed at the bottom, but it kind of gives you kind of the ideal timeline and the still possible timeline is how I'll put it. But basically, you're going to be applying, say, your senior year of medical school. And that's not always the case for everyone, but I'm just talking about it in terms of that, just to give you kind of an example. So you want to ideally take your Mcat, the year prior, and basically anytime that year you want to take it. And then, or you could take it starting into your next year or the summer before your senior year, and that's totally fine. It may just put you a little behind some of the other applicants in terms of when you apply. Now, there are primary applications, secondary applications, and interviews, and then, of course, the admissions process that rolls through. Primaries, ideally, you start applying in May, in the May-June timeframe. In terms of secondary, then, if you're approved to the next step, then you would be applying between July and September. And then the interviews would kind of be between like August and leading up into January. Of course, this can go beyond that, and that's what the gray parts blocks are that are showing kind of like a possible schedule as well. So, the test we know that you have to take for medical school admissions is the medical college admission test, or the Mcat. So there are a couple of tables here. This is one of them that shows kind of the breakdown of the sections basically that are part of this exam. And so there's 4 multiple choice blocks essentially that are included. So there's more of the chemical and physical foundations of biological systems. There's the bio section, bio and biochem. Then there's the psychological and social, and then critical analysis and reasoning skills. And then each block contains a certain number of questions. And so I'm going to actually go to the next slide because I like this table for that purpose. And it shows you the number of questions in each of the blocks. And overall, you're taking this test for 7.5 hours. So again, like we talked about study tips a little bit earlier, but that's why I say it's really important to kind of come up with the way that works best in terms of test taking skills for you early on, because medicine is one of those fields that you're going to be taking a lot of tests in. And so understanding the best way to study for you, meaning the smartest way to study for you, not the hardest way, there's a difference. What is the smartest, most effective way for you is going to be important to understand and figure out earlier on. So basically for the Mcat, plan ahead in terms of when you want to take it. So remember what I talked about your schedule, and I said, balance out your courses of what you're going to take. Consider Mcat in that process. So consider maybe I'll take it over the summer between, junior and senior year, which is a little bit later in the timeline, but still just giving you an example. But definitely plan ahead so you have a little bit more time so you can really focus on studying. If you plan to take it during the school year, take easier classes or a lighter course load around the time that you plan to take the exam. As simple as that. If you plan to take it during the summer months, make sure any summer activities still allow for time to study for the exam. And start by taking a diagnostic test to see what your strengths and weaknesses are. I personally don't like diagnostic tests because I feel like, usually we don't score too well initially. And so I personally would feel a little disheartened, but really this is an effective tool to see what you really need to focus on. Because remember I said, study smart. You don't have to necessarily study hard. And find a study resource that works best for you. So some of the ones that, I often hear people using and the ones that I would recommend are Kaplan, Princeton Review, and Magoosh is another one. Magoosh Mcat is another one to consider. And really the biggest thing I want to emphasize is do practice questions. Do as many as you can, because you actually learn a lot from just doing those practice questions. The ones you get right, understand why you got the right answer and why the other answers are wrong. And same with the ones you get wrong. Why did you get it wrong? What was the right answer? And understand the reasoning behind the right answer. So it really does help. And repeating the same practice questions over and over again is still a good way to study. So if you've completed, say, a question bank that contains 300 questions once, that's great. I would repeat them unless you have other questions too, but definitely worth doing again. And then kind of getting into what to expect in med school. So traditionally, a 4-year curriculum includes preclinicals, that's the first 2 years, and then clinicals, which are the second 2 years. The first 2 years generally are lectures, then they cover the basic medical concepts, structure and functions of the different organ systems, diseases, diagnoses, and treatment concepts. The third year, you start your standard clinical rotations or clerkships in different specialties, including family medicine, internal medicine, peds, gen surg, psych, and OB-GYN. The fourth year, you're going to do electives and subspecialties, and you'll do your sub-Is or sub-internships. So by fourth year, you should have an idea of what you want to match into in terms of residency, right? And the fourth year is also when you're going to be applying for residency. So this is the year you want to take to not only do electives, but to really do sub-internships in the specialty that you're focused on. So for me, it was family medicine. So I did a family medicine sub-I. And what that also did for me is allowed me to get an LOR from my family med sub-I attending. I also got one from my family medicine core rotation professor or attending. And so like when I'm applying for residency and I'm submitting my LORs, they're seeing that I'm very much interested in family medicine because I did a sub internship. I ended up getting a letter of recommendation from them. So it adds to your application. Of course, there are more standardized tests that you have to be aware of. The United States Medical Licensing Exam, so those are the USMLEs. Good news for you guys is one of the exams has been permanently canceled. But starting with step one, it's the basic or foundational sciences. So it covers topics like anatomy, behavioral sciences, biochem, path, physiology, fundamental communication skills. And then you have USMLE Step 2 CK, which is the clinical knowledge component. And it, again, is a multiple choice question, just exam, just like the Step 1 exam. And it covers, basically assesses your knowledge of various human organ systems, looks at the legal and ethical issues and patient safety issues. And then clinical skills, or Step 2 CS, is the exam that no longer exists. So you guys don't have to worry about that. So applying for residency, so you apply in your fourth year, like I mentioned earlier, and you go through the ERAS website for that. So when you're applying, you want to know what specialty you're going to apply into. And then you want to pick an area of the country that you plan to be in. So, say you want to be in the Southeast, like where I am, then you want to apply to programs in that area. You want to consider university programs versus community level programs versus rural programs. So, with university programs and community programs and even some rural programs, but university programs more often get you more opportunities for fellowships. Again, you can get those through other programs as well. But generally speaking, that's kind of how things work. In the university programs, you may have more opportunities for research as well compared to some of the other programs settings. And then that's where it comes to like the fellowship opportunities. Now, some specialties have a different process. For example, ophthalmology, things might be a little bit different in terms of applying. You go through a different process than that. So it really depends on what specialty you plan to pursue. Okay. So I kind of touched on this earlier, but basically for residency training, it varies from specialty to specialty. For family medicine and internal medicine, it's generally 3 years. For Gen Surg and OB-GYN, it's typically 5 years. And then in your training is when you take USMLE Step 3, which is another multiple choice exam. And then usually you apply for your fellowships in the last year of your residency, kind of like you're applying for med school in your last year of college. So that's pretty much it for my presentation. If you guys have any questions, feel free to ask me. In terms of my final thoughts for all of you, just understand medicine is not an easy field. Really give yourself patience and grace, because I can't tell you how many people struggle to get through it. So if you feel you're struggling, just know that you're really not alone in those struggles. Really make sure it is a field that makes you happy, because if you're going through the whole process of doing it, you want to know that it's something that you'll be able to pursue or continue to pursue and continue to be a lifelong learner through medicine. And then be sure to make time for your life outside of medicine, so try to find a way to balance things for yourself. So those are just some final thoughts on the field of medicine for you all. And if you have any questions, feel free to ask right now, or feel free to shoot me an email. And, you can follow me on Instagram as well at dr.avivarma. Thank you.
So I had a quick question. So what do you think are some of the greatest challenges in completing medical school and becoming a physician?
I think some of the greatest challenges are, well, I'll share my experience, is kind of how you have to, even though I I've come to a point where I'm really well trained in terms of constantly having to learn. It was something that was a challenge for a while because you can get burnt out, and burnout is quite common in medicine in general. But I'm talking more about like studying, the fact that you have to constantly be studying, which is why I really advise that you create, strong study habits for yourself early on. And remember what I said. I said study smart, don't study hard. So I'll share a couple things in regards to that. So what do I mean? So what I mean is, like, if you if you're the type of person that can't sit for several hours on end, then plan to study a little bit every day as opposed to taking a full Saturday to study 8 hours. Now, it really depends. Maybe, classes are so hard that you only have time on Saturdays, which is fine. There are ways within that you can kind of create an effective study habit. But if you're really the type of person's like, I cannot focus for that amount of time, then really studying for like one designated hour and taking breaks in between, because it is mentally draining to have to go through that whole process. And if you can make those study habits early on, it's really, really going to help you long term. Because I didn't even talk about the fact that you also have your board exam. You do your step 3 in residency, but then you have to become board certified. So then you have your board exam. And then depending on what specialty you're in, you'll have that board exam every X number of years. So you'll constantly be doing different things like that. So building study habits early is going to be important, but definitely was something that I feel I struggled with. The other big thing, which is I want to talk about, is burnout. Okay, so burnout rates are obviously very high in medicine. So you really want to advocate for yourself in the medical field. Oftentimes I hear students, and I'll say I was in the same boat, that are afraid to say anything or advocate for themselves. But one thing I'll say is that we need more doctors in this field. Like, we need more physicians. We're short on physicians, so there's a great shortage. We need more. So really advocate for yourself, because that's important. So if you need certain things, you want to be able to ask those without feeling scared that they're going to say no, or they're not going to give you the job. If it comes to that, then that definitely is not the right pick or job for you, because that means you're likely to get burnt out a lot faster. So really advocate for yourself. Make time outside of medicine for your mental health, because it's very important for you to be able to stick it through with this field.
Thank you. There's another question in the chat if you don't mind looking at that.
Yeah, so the question is, can you retake any of the exams that are in late medical training? So I just want to clarify the question. Do you mean like during residency, if you had to retake any of the exams? Okay. Yeah. So I've heard of many people who fail, step 1 or step 2, or they fail step 3. And yeah, you can definitely retake them. I think there are limits to how off or how many times you can take it, but I think it's like 5 or something. So you do get plenty of opportunities. Is it going to hurt your chances at, like with step 3, is it going to hurt your chances of getting a job? I don't recall any interviews where they asked for my step 3, but the step 3 exam is important for you because it's required for you to graduate from your residency program. So it's not so much about the job, it's a requirement for your residency training. But you'll be surprised. There are many people who fail and they take it again and they do just fine. So don't be discouraged if you do that. But that comes back to the point of creating those study habits early on so you're effectively able to study. Because I'll be honest, you're not going to get, hours and hours on end to study for these exams, because you'll be busy with your rotations, you'll be busy with your classes, you'll be busy just studying for your classes and taking your normal tests that are part of medical school outside of the standardized tests. So it's really about studying smart and effectively. Put your phone away. Phone should be on do not disturb. When you are designating 1 hour to study, that hour is for studying, not for distractions. If you can do that, it's going to really, really help you. And then when you're done with that hour, take a look at your phone and relax. So things like that are important to just start to work on early on. You're welcome.
I had another question. I saw that you chose like the MD route for yeah, but why did you consider like the DO route for medicine, or did you just want to go MD?
So I hadn't really looked into the DO because I didn't really know much about it. I didn't have much guidance going through going through college or anything like that. I went to a very large university, and the counselors had so many students, they couldn't keep track of all of their students. So I felt, even though I had role models, my role models were not like, they weren't like local to me, right? So I personally like struggled to figure out what route to take for myself. So it took me a long time to figure those things out. So I didn't really know much about the DO programs, but once I started going through residency, like I trained in my residency with DOs, and in terms of their training, it's pretty much how our training is in MD schools, but they get additional training in osteopathics, right? Like in osteopathic medicine, OMM. And I wish I had learned that. I wish they would actually include it in MD training, which I don't know if it will ever happen, but I think it's a great tool for your patients. So for me, working in the outpatient setting, if I have a patient with back pain, maybe I could do some kind of manipulation to see, is there something misaligned, is that why they're having this acute back pain, and just fix it on the spot. So I think being a DO has many advantages for sure. I think they've recently changed things in terms of their exams. Do not quote me on it, but basically, I know in the past they used to have to take many more standardized tests than we do in MDs, but I think they've changed that recently. So I think that that's definitely great for DOs to not have to do that many tests. But in terms of equivalency and all that, I think education wise, it's all the same. So to answer your question, I would have considered it if I had known about it at that time. Looking back, I wish I had.
Thank you. I also had another question. What do you think are the most important qualities to know you want to become a doctor, or like becoming a doctor in general?
In terms of qualities, I think being able to show empathy and compassion is really important because yes, there are some specialties where you don't have to have a lot of patient contact, but for the most part, your clients are your patients, right? So if you look at it from another field's perspective, so you have to have the patience to sit there and really connect with your patients on their level. And I feel like, I have to do that every day in family medicine. So really being an empathetic person, being compassionate, I think those are really, really, really important at making a good physician. One thing I want to say is being a good test taker doesn't make you a good doctor. It's really about like your skills as a physician and how you connect with your patient, because you have to build trust with your patient. There's so much mistrust in the scientific community. We know this with COVID, right? With just in general, people are just not willing to trust public health as much. But same thing with the medical field is over the years, trust within the medical community has really declined. And so I think it's very, very important for future physicians and even current physicians, but future physicians especially, to be able to find ways to connect with their patients and to be able to build trust, because that's important in, educating patients and making them understand and advocate for themselves in terms of their health.
Do you ever perform any procedures?
Yeah, so I just do minor procedures in the office. So I kind of mentioned skin biopsies. So I work in HIV. So, I actually do see quite often I see skin infections that, I'll have to IND. So I'll do things like that. Biopsies are some that, like I said, I'll do as well. I haven't been doing as much in terms of joint injections and whatnot, but there are different things you can do. I don't really count pap smears as procedures because they're not surgical procedures, but doing pap smears for cervical cancer screening, some people look at as a procedure. And so I'll say that I do those regularly for my patients. Um, and we do anal paps as well for our males. So it's really important with HIV, who are often, at higher risk for HPV infections anyways. And as a result, cancer related to that.
And I had one last question about If you didn't know how to treat a patient or you didn't know about something in medicine, I'm sure that happens. What do you do? How do you handle?
Yeah. So one of the reasons I started my first job in a large medical practice was because I knew being fresh out of residency, there are going to be things that I don't know. And so I was surrounded by 9 other physicians who had varying number of years of experience under their belts from like, 5 years to like 30 years. So another thing about, you were talking about characteristics, but like being humble and just knowing that not one physician knows everything in the world in regards to the field of medicine, especially since it's constantly changing, and being willing to accept help. So, I would turn to my partners all the time if I had any questions and I wasn't 100% sure about a treatment plan for a patient, because honesty and openness with your patients is important. If you don't know the answer to a question, you shouldn't just come up with an answer. Like, that's not the way you practice or provide care to your patients. So, if something I'm not sure about something, I always say, I will get back to you about this. And go either look it up or consult a colleague. In terms of looking it up, there are always resources you can turn to. So, I have my resources that I'm usually turning to if I need any help or assistance in figuring out an answer to something that I'm not 100% sure about.
Are there any more questions for anybody? Okay, I think that's it. Okay, thank you so much for coming again today, and thank you for answering my many, many
Yeah, of
questions.
course.
Um, yeah, I really enjoyed looking at your presentation, and you guided us all the way, like from high school to med school, after med school. So it was amazing. Thank you so
Yeah,
much.
absolutely. And thank you so much for asking me to come and speak with you guys. I really enjoyed it.
Thank you.
Bye.
Have a nice rest of your day.
Thanks. You too. Bye. Bye, everyone.
Bye.